Seizures are characterized by synchronized high-frequency neuronal firing in the cerebral cortex, and this causes temporary neurological signs. Now, it's important to realize that seizures are not all the florid, myoclonic, jerky movements that you might think of. They come in many different forms. To begin, seizures are organized into two types, partial and generalized. And partial simply means that the seizure affects one area of the brain, while generalized means that multiple areas of the brain are involved. Partial seizures can be further split into simple or complex. And in a simple partial seizure, all that means is that the patient maintained consciousness throughout the seizure, whereas in a complex partial, the patient loses consciousness throughout the seizure. Now, generalized seizures can be divided into a number of different types, which we will now go through. So here's a good example. A child comes to your office. His parents say that his teachers are complaining that he sometimes does not pay attention in class. Upon testing, you receive an EEG that looks something like this. What is the diagnosis? Well, that sort of vignette is a classic type of board's question for absence seizures. These are most common in childhood, and the kids will space out for a few minutes and then snap back to reality. Uninformed parents and teachers may think the child is daydreaming. It is characterized by a classic 3 Hz spike and wave on the EEG. This EEG is actually a great example of this. Can you tell where the seizure starts? Well, it starts about right here, and you can see sort of the 3 Hz firing there. Most kids will grow out of absence seizures during adolescence. So now let's go through the other types of generalized seizures. I'm going to illustrate my superb stick figure drawing skills to try to guide the discussion of these. So myoclonic seizures are quick, repetitive, jerky motions of the muscles. A grand mal seizure is sort of your classic movie type of seizure where you have alternating jerky motions as well as stiffening of the body. In a movie, maybe you also have like some foam at the mouth or something. This is kind of, I guess, the classic representation of what most people think a seizure is. So for tonic seizures, let's say this is someone's normal relaxed posture. You can see he's kind of cool. He has on these shades. Well, in a tonic seizure, he rapidly stiffens, and that tonic there is referring to the tonicity of the muscles, and that's what's actually stiffening. Lastly, in patients with atonic seizure, they rapidly will fall to the floor. And this is occurring because they're basically losing tonicity, atonic, of the muscles. These patients usually are injured by the fall but actually do not have any adverse effects due to the seizure itself. Now, other signs of seizures include tongue biting, loss of urinary or bowel control, and you can also have auras. Now, all these characteristics distinguish seizures from syncope. Now, seizure does not equal epilepsy. Isolated seizures can occur in both children as well as adults. If the seizures are recurrent, then a diagnosis of epilepsy may be made. In children, seizures are usually due to genetic causes or fever, trauma. Simple febrile seizures are actually very, very common in infants with high fevers, and in most cases, these kids will not go on to develop chronic seizures. In adults, you should elicit a history of trauma, again, stroke, or infection, one sign of which would be fevers. And in most cases, you should definitely rule out things like brain tumors or some other sort of mass lesion. Think of any lesion in the brain as a foci for a potential seizure. That's kind of a general rule in terms of thinking of what things could cause a seizure. One of many interesting facts about the brain is that although it is the site where pain is ultimately processed and felt, the brain itself does not actually have any pain receptors. This means that a headache is a sign of irritation of something other than the actual brain. It is coming from pain-sensitive structures such as the dura or maybe the cranial nerves, and there are some other extracranial structures as well. Now, there are different types of headaches, and these are the ones that you definitely want to know for your exam. Let's start with migraines. These are usually unilateral with pulsatile pain. They have a variable duration and are commonly associated with nausea, photophobia, and phonophobia. Now, some patients describe an aura, and this includes visual, sensory, and speech disturbances. So one mnemonic that you can use to remember the symptoms of migraines is as follows: POUND, and that stands for pulsatile, 1 day, unilateral, nausea, and importantly, it interferes with daytime activities. Migraines are thought to be due to the dilation of blood vessels innervated by the trigeminal nerve caused by release of neuropeptides such as substance P. Now, substance P is released from parasympathetic nerve fibers. The treatment of migraines can be aimed at either aborting migraines or preventing them. So, on the side of aborting migraines, we have medications such as ibuprofen, acetaminophen, sumatriptan, or you can just sit in a quiet room by yourself and chill out. Now, like we said, there are also therapies that are aimed at preventing migraines. These include propranolol, the tricyclics, and calcium channel blockers. Tension headaches are the most common type of headache. In fact, perhaps you've had one after a long day of studying for the boards, or maybe after an argument with your significant other. Now, most people do not seek medical attention for this sort of headache, although they may consult a psychiatrist for their significant other. Tension headaches are commonly bilateral, so that's an important distinguishing factor from migraines. They are tight, but not pulsatile. Again, another distinguishing factor from migraines. There is no photophobia or phonophobia, again, something that we see in migraines. And the pain generally will resolve with a low dose of ibuprofen and acetaminophen. Cluster headaches usually affect middle-aged men. They are called cluster headaches because they tend to cluster in time. There are multiple episodes of unilateral periorbital pain, and that occurs daily for about several weeks, and then all of a sudden the symptoms will abate for some period of time. This guy, Franz Kafka, one of the most influential authors of the 20th century, suffered from severe headaches in the region highlighted in red. It is thought now that maybe he suffered from cluster headaches. So you should remember this picture to remember both the demographic as well as the location of cluster headaches. Also, remember the key features of this headache is often associated with ipsilateral nasal congestion, a runny nose, tearing of the eyes, these are my well-drawn tears, and Horner syndrome. The treatment for cluster headaches is sumatriptan. Now remember, this is a serotonin agonist, and we've discussed it before when we talked about treatment of migraines. So you definitely want to think of sumatriptan when you're thinking about treatment for various headaches. Now, if a patient without a history of headaches suddenly develops a headache, begin worrying. First and worst headaches are more likely caused by nasty things such as subarachnoid hemorrhages, meningitis, hydrocephalus, or arteritis. These patients will usually complain of the worst headache of my life. As we discussed in physiology lectures, you should definitely remember this phrase as a key hint for subarachnoid hemorrhages, worst headache of my life. They usually do not have chronic headaches, or at least the caliber of the headache is different. Now, if the headache is more subacute to chronic, consider brain tumors, which often present with headaches. Now, importantly, the type of headache that you get in tumors usually have red flags that make a tumor more likely. For instance, they usually will worsen with straining, such as you would see on maybe Valsalva, or really anything that increases the intracranial pressure will cause these headaches to worsen. This could be something such as sexual activity or bowel movements. They also tend to wake a patient up in the middle of the night, whereas benign headaches almost never will do this. On physical exam, you may also see findings of increased intracranial pressure, such as papilledema. Now, when you see a question about headaches, it is very unlikely that you will be told what type of headache it is. Usually, you will get some description of that headache and will then have to make some second or third step to either the treatment or the etiology of said headache. So, you should definitely be able to identify what type of headache a patient is having based on a description. You should also remember the triptan family of meds and their use for treatment in migraines as well as in cluster headaches.